welcome back to my channel. Welcome to another pregnancy update, 25 weeks update. I've been doing these updates frequently lately because it seemed like you guys enjoyed them a lot. Let me know in the comments below if this is a wrong impression or you do like weekly updates, or every 2 weeks should I do them? Let me know. So if you're new here, then welcome. It's so nice to have you. My name is Karyna. I'm a full-time mom. I have a daughter whose name is Michaela, and she is 2 years old, and I'm currently pregnant with a baby boy. And here on my channel, I share my motherhood journey, my pregnancy journey. I share my experience, tips and tricks, ideas to try and make motherhood and fatherhood a bit easier on you. So if this sounds like something you'd like to watch, please consider subscribing, hit the bell icon. I do post every single Thursday, and now I also post a bonus video here and there, so make sure to don't miss out on my new content going live. So today I want to start with the fact that I've been dealing with cold in the whole past week, and it started even before. I still have a little bit of congestion. It kind of was on and off, and I would feel good one day and worse another day, and that's why I did not exercise and almost did not do any stretching at all in the past week. So we're actually talking about week 24 and a little bit into my 25th week, because I just turned 25 weeks 3 days ago. So unfortunately, I did not find it in me to exercise because I felt like I need to preserve that energy to get better. And stretching, maybe I could have stretched a little more, but I was lazy, and truly I was feeling off this week, like maybe every other day. But thankfully, probably because I did exercise very frequently in the past months, I did not get my sciatic pain back. I know I have to continue stretching for that, but I'm so thankful and I'm so proud of myself that I was able to stick to my exercise and stretch routine in the past months, and now I can feel a little better than, a month ago when I started feeling all of those aches and pains of second pregnancy. So yeah, feeling better now. Going to come back to my exercise routine hopefully this week, and definitely need to do stretches because I do not want that sciatic pain back. So there were a couple of interesting things that happened to me in the past week, and one of them is being depressed again. There was one afternoon when I just couldn't help but wanted to cry, and I was holding it because there was no reason whatsoever, but I just felt down. I felt upset, and I just felt like I need to cry, and I ended up crying, and it helped. I used to feel that almost every afternoon. This was just an episode. I haven't felt like that in a long time. I told you that I started exercising more often, and I also changed my parenting routine with Michaela. We quit her cartoons, and it helped, and just having guests over and being on staycation helped. But that afternoon I couldn't help. I'm sure it's just those crazy mood swings, hormones in pregnancy, and I just have to deal with it. What can I say? I'm trying to do everything to prevent it, but sometimes it's just out of my control. The second interesting thing that happened actually is a long story. So first of all, every time I tell you this, guys, I know you're tired of hearing it, but I feel so heavy, I feel so big, and my belly is about to explode. Every week it just feels worse, obviously, because I'm obviously growing. But this week my belly actually reached the point where it pushes my stomach and my lungs, so I can't eat my normal portions anymore, and I'm out of breath sometimes. So what happened is I had to go to my annual check at just primal care doctor. She's actually a nurse practitioner. It was my first time seeing her, and everything was going good until she rushed into the room and said that my heart rate is way too high. I'm like, what's going on? She was so concerned. She started asking me questions like, do I feel chest pain? Do I have any swelling? Do my legs hurt? Stuff like that. I'm like, no. Are you out of breath? She asked. And I actually just had breakfast and I was in a new environment. And she mentions that too. She's like, yeah, I understand you're probably in the new environment, you're pregnant, but your heart rate is up. But my blood pressure was actually lower than my normal blood pressure. So that was very strange situation even for her. And my heart rate was actually 120 beats per minute. And when she told me about it, I started feeling it. But the only thing I really felt that I was out of breath just from sitting on the chair, waiting in the lobby, and just wanted to lay down. And like I told you, I did not have much space here anymore at that point, but she was so concerned. She told me to see my OB as soon as possible. So I did make an appointment to see my OB because she knows me better. They have all my vitals from all this pregnancy. And I saw her today and I told her all the concerns, and she said that she thinks it's just fine because I feel okay. That does not happen all of a sudden. It does happen when I eat a little too much maybe, or when I eat and then move around a little bit and I can feel out of breath, and which is normal. So the only thing we decided on is to get me some kind of wristbands that can measure my heartbeat. We need to get one for me, and just in case, so I can monitor it. And if it starts going up to 120 again, like today it was 90, which is normal, and my blood pressure was normal too, like my normal, and it's pretty low and it's nice, luckily, thank goodness. So that was very interesting situation. That nurse practitioner at the other practice was so concerned, and I just wanted to double check because it did happen to me again the next day after I saw her. I did have that rapid heartbeat after I ate and then like did the dishes and did a couple of things, and I had to lay down and just rest, and then it went away. And now I'm trying to eat smaller portions and stop when I actually feel that I can't breathe. Not really. Sometimes I'm still hungry, I want to eat more, but I already feel that if I eat more, I'm gonna be not able to breathe good and stuff like that. So you can hear that I'm out of breath now even, and I'm even kind of sitting a little uncomfortable. I'm wearing a skirt. I kind of want to let my belly hang. So that's what's happening. Like I told you, I feel big. It's so hard to turn around at night, and sometimes when Michaela is still waking up at night and I have to maybe stand up and get her water or something like that, or I need to stand up and go to the bathroom, or I just need to switch sides. It's just so uncomfortable. And I'm just 25 weeks. And another interesting fact, which I'm not happy about, my weight is almost the same as when I went into labor with Michaela. I'm worried about how I'm gonna be feeling in the next, how many weeks is it? About 15 weeks until I have to give birth. Like, I'm feeling so heavy right now, and I am indeed almost the heaviest I've ever been. And at this point it feels to me that I'm gonna see such a huge number in the end of my pregnancy on the scale that it's gonna freak me out. But it's not about seeing the number, it's about how I'm feeling. I can't really complain because I do look cute, you know. I'm only pregnant in my belly, really. My face does not look big, my arms, my legs, everything looks okay. I'm definitely gained maybe a little bit, and you know, just the quality of my skin and muscles is not the same, but generally the only place I'm gaining is my stomach. You can tell, right? I'm out of breath, but don't worry, my heart rate is okay. Another thing, what my doctor told me, I should try to drink more liquids, water preferably, because it's supposed to bring my blood pressure a little up and my heart rate down. But don't take this as medical advice. If your heart rate is up, talk to your doctor. Everybody is different, your doctor knows you best. So this is what has been happening. It was a little scary when the other doctor nurse told me, because she even told me that she should be sending me to the hospital with this heart rate, which is ridiculous, I think, because my OB told me 140, 160 is dangerous and you should go to the hospital. But 120 in pregnancy sometimes should be fine. My Braxton Hicks are still with me, and I'm sure they're just gonna be increasing as time goes by. I had a couple of episodes when I will get intense lower belly pain, lower back pain. The other day I even had to breathe through it but luckily it was very short, but they are intense. Nothing comparing to my first pregnancy. I really think in my first pregnancy I've got real Braxton Hicks maybe once, and I was 34 weeks and I did not know how labor will feel for me as they were in my back. I really did not expect that. Everybody tells you that contractions is when your uterus is contracting, your belly is getting tight and blah blah blah, but it was not for me. So it did freak me out a little bit in my first pregnancy, but I was not even sure if that's Braxton Hicks or I'm in labor. And I remember even at some point I was thinking, what if I'm in labor? What if this is contractions, because they were coming and going kind of. And I did not even pack my bags at that point. By the way, this pregnancy I'm gonna pack my bags much earlier because I know my labors are fast and I'm just hoping to make it to the hospital. Other than that, I felt like I needed to sleep my good 8 hours at night to feel good, because if I decide to wake up in the morning and exercise or edit my video, I would feel off the rest of the day. And sometimes, because I have a toddler who sometimes wakes up at night, or maybe she could have like a bad dream and then I would lose a couple of hours of sleep in total. It does not always happen, but I do feel the increase in need of good sleep. And also had a very strong headache this week, almost all day long. But other than that, that's all. Thank you so much for watching. If you enjoyed this update, make sure to give it a like. It helps me out tremendously. Make sure to subscribe to my channel, hit the bell icon, and I see you next week in the next update. And I want to wish you to have a smooth pregnancy. Bye.